Hello and welcome to EcoMap, the practical, easy, and above all, useful ultrasound for general practitioners. So, as always, if you like my videos, if you like my content, subscribe to the channel, give me a like, it really helps me a lot. Leave me a comment too, it encourages me. I love reading your comments. It's true, it really motivates me every time to keep posting videos. It's true that it takes a little bit of time, but I really enjoy reading your messages. If you have any questions, don't hesitate. I'll answer you and help you make progress. Same thing on Facebook. Give me a like, subscribe on Facebook to stay updated. And the ultrasound training is still available for free. The link is in the description. All you have to do is click on it and join me for an introductory training. In the ultrasound course, I explain how an ultrasound machine works, how to use the buttons, how to use the artifacts, how to get started the right way, and how to do your first scans. So today, we're going back to the clinical case from a previous video. This is the follow-up. Actually, you can also find the link in the description of the first video. So, this video was about a 73-year-old patient who had pain in his right groin when he did DIY projects and gardening. He was worried, had looked on Google and saw it could be a hernia, and came specifically to the office, basically so I could check with the ultrasound machine, to put it as simply as possible. So using my Sue technique, which you can see again in the first video, started from the testicle, we discovered that this patient did indeed have a mobile inguinal scrotal hernia. I'm gonna show exactly how to spot them. Almost for sure, even when it's a fatty hernia. And today, I'm gonna help you tell the difference between two things. To tell the difference between a direct hernia and an indirect hernia. So the question is it the sonographer's job to say whether it's a direct or indirect hernia? It can be useful. Some surgeons like to know, before they get their hands a little dirty, if I can put it that way, where they're going, because it can guide their procedure. So it's not something, once you really understand the principle, it's not something very difficult then. In any case, I recommend that you try to include it in your reports and apply the advice that you're about to see right now in this video. So what is a direct hernia? It's a hernia that makes its own path through the abdominal wall. It doesn't follow the spermatic cord, it doesn't follow the inguinal canal, it makes its own path, its own opening, and it goes through this hole. Whereas the indirect hernia passes through an opening in the inguinal canal, following the spermatic cord. Is it easy to tell the difference? Yes, because we have a good landmark. Once you really understand this landmark, I'd say it's pretty easy to tell the difference. So you see that actually is the same image, we're just explaining it a bit differently. Our direct hernia makes its own path, while the indirect hernia follows the spermatic cord through the inguinal canal. What's important to remember is that this direct hernia will be found inside, on the inner side, inside the epigastric vessels, whereas our indirect hernia, this time, will be found outside the epigastric vessels. Why outside the epigastric vessels? Because our spermatic cord passes outside the epigastric vessels. And so, since this hernia will follow the cord passing through the inguinal canal, it will logically take the same path as the spermatic cord. So we'll use the spermatic cord as a reference to better understand its path, and to differentiate between hernias that are called direct and those that are called indirect. So here you can see our inguinal canal with, right here, our spermatic cord. Our spermatic cord here passes through this natural opening, the inguinal canal. And you can see here that our cord passes outside and above the epigastric vessels. The epigastric vessels are easy to identify. I'll show you how it's done. We're going to locate them at the level of the rectus abdominis muscle. At first, they'll just be stuck right behind the rectus abdominis. Here we have the patient's right side, of course. These are the femoral vessels. Right. Our epigastric vessels will be attached underneath the rectus abdominis. At some point, we'll see them go deeper. They're going to go deeper to join up with the femoral circuit. Join it, or at least partially, right? Here, I'm speaking from an ultrasound perspective. Obviously, arterial blood flows in this direction. So let's get back to the point. You'll see your epigastric vessels separate from the rectus muscles and become deeper. And as they become deeper, they'll actually join the femoral vascular circuit. And that's where our hernia will appear outside of these vessels and will bridge over them. If we now put ourselves inside the patient's abdomen, so now imagine we're inside the belly looking from the inside. You can clearly see our epigastric vessels, which are stuck to the rectus abdominis, becoming more and more lateral. You'll see it well in the video. More and more lateral, and at some point, they'll leave the rectus abdominis and become deep. Well, you see, it's exactly at this spot that you'll look for indirect hernias. So, indirect hernias will appear at this spot, and as you can see here, they'll pass clearly outside the epigastric vessels. Outside and above. Above, the distinction is important for understanding, but it's harder to demonstrate, whereas outside, it's very easy to demonstrate. So here, you can see how we're going to do it a bit with ultrasound. So what's the technique? We're going to take a transverse section that follows the rectus abdominis muscles. It's very easy to spot. And we'll move the probe down gradually until we reach the inguinal ring. We'll keep moving down, always in the transverse plane. We'll see the epigastric vessels gradually leave the rectus muscles and become deeper. And in this area, in this sector, we're going to look for a hernia. And we'll see if our hernia is located outside or inside these vessels. So, just a quick aside, you can look for hernias this way. Hernias or prehernias, but I still always recommend that you follow the spermatic cord starting from the testicle and moving upward. Because in my opinion, it's easier. And if, after you follow the whole length up, you haven't seen anything, you haven't found a hernia, then you can use this technique to look for a hernia. This video is mainly to help you tell the difference between direct and indirect, but you can use the same technique, exactly what I'm telling you here, to look for hernias as well, if you didn't find them with my first method. So what does that look like? We're going to start the dopping. So here, we're on the patient's right side here, and here we're on the patient's left side. Here, of course, we have the rectus abdominis muscle, and we're going to look deeper beneath this rectus muscle. The epigastric vessels, as you can see, are right here, really stuck deep underneath our rectus muscle. And you'll see that gradually they're going to move, they'll already start to become one. They light up very easily on Doppler, and they'll gradually become more and more lateral. There you go, until they become deep. You can see here, they're starting to sink in. And it's exactly at this spot, when these vessels become deep, that you'll need to look outside the vessels, meaning in this area, for an inguinal hernia, specifically an indirect hernia. Direct hernias will be roughly here, on the inside of the vessels. So, you see that once we've identified the vessels, it's pretty easy. I'll show you the technique again for locating the vessels, as always. We locate our vessels, which are deep to our straight muscles, using Doppler. We go down, down, down toward the patient's pubis. Our vessels are still there. The vessels are starting to get deeper. This is the moment to stop going down and check if, on the outside, you can spot a hernia. How do you spot the hernia? It's always the same story. Ask your patient to perform a Valsalva maneuver. So either it appears very clearly on the screen right away, which is rare, or during the Valsalva maneuver, you'll unmask the hernia or a prehernia, and you'll see it show up as a mushroom-shaped bulge on the image. Let's look at the images. So our epigastric vessels are still there. They haven't changed compared to earlier. We're looking in this area. There you go. You can see something starting to come out when we have the patient breathe. There, our hernia is here. It's really the breathing that makes the hernia image appear on the screen. Very clearly, if I leave the image completely frozen like this, yes, okay, you know you have your vessels because you just turned off your Doppler, so you know they're here. But it's still hard to say that here. We have an indirect fatty hernia. It's still very complicated, very difficult, because in fact, it's almost impossible to distinguish the hernia from the subcutaneous tissue. But if we have the patient breathe, exhale, and strain this time, then, thanks to the patient's breathing, we'll see this hernia appear and swell at the moment when the patient blows through their nose. You can see it appear here, this bulge, and that's what will reveal the hernia. So, another video. So, here are our epigastric vessels again, which are easy to identify. So here, I've identified the epigastric vessels. So I'm going to turn off my Doppler. Looking for them, so the vessels are still here. They haven't moved. Look outside the epigastric vessels if we're dealing with an indirect type hernia. I want to emphasize this point. There you go. I asked the patient to exhale, and you can see the hernia bulge appearing, which will protrude and start pointing toward the surface. This is completely pathological. So here we clearly have a mobile hernia during Valsalva maneuvers, which is definitely outside our epigastric vessels. The external side, my patient's right side, is here. So the epigastric vessels are here, and we clearly have a hernia outside the epigastric vessels. I won't say any more. I'll show it to you one last time. I think you've understood the technique to tell the difference between a direct and an indirect hernia. You've also learned how to look for it, this time directly at the level of the inguinal ring, even if it's the beginner's technique I recommend, but you can still try it out. So I hope you enjoyed this video. It took me a lot of time to prepare this set of two videos, but I really wanted to focus on hernias because I can't find many simple videos out there that simply explain what a hernia is and how to look for them with ultrasound. If you enjoyed it, give me a like and subscribe to the channel. Same thing on Facebook. Like and subscribe on Facebook too. And don't hesitate to join me in this free ultrasound training. The link is in the description. I'll explain how to get started with ultrasound, how to set up your device, and how to use artifacts effectively. Alright, I'll say bye-bye and see you soon for another video on EcoMap.